Today, we're going to talk about stroke in young people. Approximately 13.7 million people get stroke worldwide, and 10 to 15% of those people are ages 18 to 45. So today, we're going to help you understand what the different types of strokes are, what the risk factors are, what you can do to recognize it, and what you can do to prevent it. A stroke is a medical emergency that when part of your brain's blood supply is reduced, causing lack of nutrients and oxygen supplies to your brain cells, causing it to die within minutes. There are three main types of stroke: ischemic, hemorrhagic, and TIA. Ischemic stroke is the most common, which accounts for up to 80% of all strokes. It is when your brain's blood supply is blocked by a clot. Hemorrhagic stroke is when your blood vessels in your brain pops or bursts, which leads to what we call brain bleed. TIA, transient ischemic attack, which is also known as mini stroke, is a temporary stroke-like symptom for your brain. But it's not going to cause permanent injury. However, it is an indicator that you may have a stroke in the future. Now, let's talk about why there's an increase of younger people getting strokes. First of all, is sedentary lifestyle. People are getting more obese, people are getting more inactive, they're all on their cell phones and computer all day, which can lead to hypertension, diabetes, and all the other chronic symptoms. Poor dietary habits. People are eating more sugars, processed foods, high cholesterol foods, which can lead to blocked arteries. Substance use. People who smoke and use drugs are more likely to get stroke because drugs like cocaine or meth can damage your blood vessels. Stress from school, work, or personal life can also increase your risk of getting cardiovascular diseases such as stroke. Lack of healthcare access and awareness can also lead to poorly managed risk factors, and that's why I'm here. Now let's talk about how we can recognize stroke. The most common acronym to use is FAST, which stands for facial droop, arm drift, speech difficulty, and time to call emergency services. But there are also other common symptoms such as sudden weakness or numbness, especially on one side of your body or your face. There is also vision loss in one or both eyes, confusion, difficulty understanding speech or speaking, severe headache, and difficulty walking or balancing yourself. If you're experiencing any of these symptoms and you suspect a stroke, you should call an ambulance and visit your emergency department as soon as possible. Stroke is a time-sensitive medical emergency, and most oftentimes it can be saved by medical interventions. Now we're going to talk about ways to prevent stroke. And first of all is diet. You want to eat less unhealthy fats, such as ones that contain LDL. You can opt for unsaturated fats like olive oil, avocados, and even fish. You can also eat more vegetables, eat less processed food, and have less sugar and salt in your diet. Aim for at least 150 minutes of cardio-active exercises per week. Maintain your body weight by managing your BMI, which stands for body mass index. You can monitor the intake of calories that you eat and the output of exercises that you do. Manage your stress through meditation and exercises or yoga, and have a peer support group that you can talk to socially. I hope this video will help you, your friends, and family to minimize the chance of having a stroke. Subscribe to us for more weekly videos on how to take care of yourself and recognize these health issues. Thanks for watching.